This is a webinar for a beginner's guide to evidence-based practice. And what we're hoping to achieve today is to look at the new 4th edition of Helen Aviard's seminal text, A Beginner's Guide to Evidence-Based Practice in Health and Social Care, as well as what evidence-based practice really is and how it relates to both practice and academic work. We're joined by all 3 authors, Helen Aviard, Kathleen Greenaway, and Lucy Parsons. Helen is Principal Lecturer at Oxford Brookes University, Kathleen is Senior Lecturer at Oxford Brookes, and Lucy is Divisional Director of Nursing at Oxford University Hospitals NHS Trust. On the interviewing panel are instructors who are using this text, Fiona Chalk, who's Senior Lecturer at Buckinghamshire University, and Ruth Trout, who's also Senior Lecturer at Buckinghamshire University. And looking after our final Q&A is our Executive Editor, Sam Crowe, who manages our health and social welfare portfolios for Open University Press and McGraw Hill Higher Education. I will be sharing a link in the chat for those of you who have not purchased your copy yet, with a discount code so that you can have 20% off at checkout. But without further ado, I shall be passing over to the panelists to begin their interrogation of our lovely authors.
Thank you. Good afternoon, and thank you, ladies, for this opportunity to discuss evidence-based practice and what it means for both healthcare professionals and for students working on our healthcare courses. Perhaps the first thing we should do is ask you to give us an overview of what the book is about.
Thank you, Ruth. Yes, so in overview, this book is about evidence-based practice, and essentially what we're focusing on is getting evidence into professional practice. We're focusing on a wide range of evidence. We predominantly mean research evidence, but we're also very conscious that we build our practice on other forms of evidence, and we take a really good critical look at that as well. Evidence-based practice is not only evidence, as we're probably all very well aware, but it also refers to professional judgment on behalf of the clinician and patient preference. So we do address those aspects of evidence-based practice as well. In the book, what we do is we take the reader step by step through the stages of evidence-based practice, in terms of we talk quite thoroughly about how to search. Then we look at what type of evidence you might find as a result of that search, and we break that down into research evidence and other different types of evidence. We look at critiquing and appraising that research, and then finally we look at the complex aspect of getting that research into practice.
Thanks for that, Helen. So why does evidence-based practice matter? Why is it so important?
So I think evidence-based practice matters because we have such busy working lives as health professionals these days, and there's so much out there which can actually overload us, not just from our guidelines that we're given for whatever it is that we're looking for our information, but down to things like even social media. And it's very difficult sometimes to make choices, the correct choices. And so that's where evidence comes into it. Although it is also, of course, a lot of what Helen already mentioned about the patient, what the patient actually wants out of maybe their different options for treatments, and about our clinical professional judgment. So all of that comes into play. But why is it important? For so many reasons, not just giving that, just helping you make that decision about what is the best path of treatment for somebody, or a decision about what you want, some therapy for them, but it's thinking about what is actually effective, what works, because we all don't, all of us, whether it be, the professional down to the patient, really don't want to be going down, making choices down paths that are ineffective, that don't work for them, that use time, energy, resources. So it's finding out what is best. So we're basing it on the evidence out there. We all need to walk down the path together with our patients. So I think that is the most important aspect of why it matters for me.
Fair enough. So a lot of different terminology out there. Is this the same we're talking about as evidence-informed practice?
Quite simply, yes. So what we've seen is, since the original definition of evidence-based medicine, we've seen that term evolve really to make it more accessible and more user-friendly, so more accessible to other professionals. So it's moved into evidence-based practice. You'll see other terms such as best practice, evidence-based nursing. So yeah, but within the literature, evidence-based practice is still the common term used.
And so that's what evidence-based practice really means, is that it's this colloquialism, the different variation across terminology that we see across various practice areas and professions. And that's what this book is about.
Absolutely, sort of starting as, you know, being a curious practitioner. So why do we do this? You know, and using that evidence. I was asked recently as a project, Lucy, you need to sort of reduce the number of falls. So going back to the evidence, we don't do, you know, looking for postural hypertension well. You know, we need to be looking at recording blood pressure on standing. So using that evidence in practice, but it's the translation into practice. Loads of research out there, but it's what we do with it and bring it into practice for the care of our patients.
Thank you, Lucy. And I think as well, when you look at all the different definitions, they some of them emphasize more than looking at the research, some of them emphasize the clinical judgment, but actually all of them are talking about the same thing. And we're very clear in our book that we're looking at the research, but how the clinician interprets that research using their professional judgment, but also how the patient preference comes into that as well.
So if I'm a student doing a university course that requires me to incorporate evidence-based practice into an academic assignment, will this book help me to do that?
Absolutely, it will. Absolutely. When we wrote this book, the original first edition, we were very, very aware that a lot of students were that maybe just a little bit cautious about research, and they maybe thought they couldn't do it, they didn't understand it. And we were very passionate about was unpicking that and presenting the whole concept of research and evidence to our students in their first year as something highly, highly accessible that they could get their head around. And we wanted them to we just wanted to unpack it so that the whole concept became alive and accessible to our students. On writing the book, originally we then discovered that actually the market for the book was wider than just first year students. We thought originally we were writing for first year students. It then became apparent that their mentors were reading it, their lecturers were reading it. So we realized that the market was much broader. The book really remains for me as an introduction to research, an introduction to evidence-based practice. So as such, it can be used as a textbook which takes you from start to finish with that step-by-step approach to understanding evidence. But there are other uses of it. So for example, I know that some people do use different chapters of the book in different ways, and you know, we're absolutely happy about people doing that, because each chapter is an end in its own right. But also I very often recommend the book to people who are doing further study but think, oh gosh, I just don't get that aspect of evidence. So we say, well, go to our book, because it's written there in a sort of beginner's way, as the title suggests, in a very accessible way. We've simplified the terms. We hope we haven't oversimplified the terms, but often when people read that and then they think, oh, okay, is that all it means? Right, I get it now, I can move on to further study. So we really do recommend the book as a background for anybody who is going on for further study as well. So it's actually, the book actually has more uses than when Pam and I started out back in 2000 and whenever it was, than we had originally intended, for sure.
I think you've talked about this already, but how has the book been received? And as you said, it's now on its umpteenth edition now.
Yeah, so it is now on the 4th edition, and as Helen said, it's been quite a lot of development over time with the editions that she's done, and obviously she's brought Lucy and myself on for this edition. And the book has been very well received. I wouldn't know about the particular amount of figures. I'm sure Laura or Sam can give you those details later on. But I know just from my particular perspective that at our university, it's recommended as a core text, so it is recommended to the first years when they come in, and it's a text, as Helen says, that it's not only used with first years, that we use throughout the course. I also teach on international programming in Hong Kong, and we use that for our students out there, and these students are actually qualified nurses taking a top-up degree, so they need that experience in integrating evidence-based practice, and as Helen says, learning about what we might call core research skills, which are addressed within the book. But it's not just about nurses, it is about all professions, and we've made sure to, although some of the examples we use might be slightly more nursing focused, we have tried to move away with that with this edition and become more health profession focused with the exemplars that we use, and we're very well aware that it encompasses all professions. This is not just something nursing specific. Thank you.
You've said quite a lot about this already in just your comments here, which I think is really interesting. So why did you decide to update the book? What drove your changes?
Okay, so for me, updating a book is just an opportunity to get it better, basically. So you start off with the text, and it goes out there and people read it and you get lots of feedback. And for me, what I do is I store that, I retain that feedback, and it's always in the back of my mind when I'm going to update a textbook. So what with the help of the publishers, what happens when you update a textbook is that they send it out for review, and you generally get some really detailed comments from peer reviewers, which helps you to sort of understand the shape that the book, the next edition should go in. But equally important as that is for us as a team of authors to shape the book where we feel it should be going as well. And as I say, it's an opportunity to perfect it. So if there's something, all right, I'm going to change that example, it's either in response to feedback or in response to our own feeling about where we want to take that book. So for me, it's just an opportunity to make the book that little bit better. So we've got our ear to the ground. We're always looking at different. So for example, with the discussion on terminology used in evidence-based practice, we listen to all of that, and then we come together with an author team and we think, okay, well, what is our view on that? And that's what sort of then goes in the book. And it's an opportunity to update the book to making sure, as Kathleen says, we've got appropriate number of international considerations, and an appropriate number of reference to all the different healthcare professions who use the book, and just to make sure that the book is in keeping with current trends of the time, really, in terms of the discussion in the area.
So sort of put a few different points in there, but what particularly do you think's changed in the new version of the book? Why do you think it's still relevant?
So we did keep looking at what the current trends and arguments were around evidence-based practice. And as Helen said, we took note of some feedback that we had from previous versions, and had some thoughts about that, and moved those examples on. We made them very all healthcare professional centric. We were also able to draw upon quite recent evidence-based issues that have been around recently, and the main example for us was COVID, and how very different examples about what was the evidence and what people should do was out there, and we've all experienced that. And so we did base a lot of examples around that topic, and making decisions about evidence based on conjecture and based on actual statistics and theories and what we know about COVID. So we were able to make it a lot more relevant and a lot more contemporary.
we feel.
And I'll just add to that as well, in that student cohorts don't really change very much. Students are still our students, and we still see the big need that students need clear advice and a clear narrative about research and its importance to practice. And we still also feel that research needs demystifying. I'm sure any of our students in the audience today would agree with that. The need for research to be demystified remains really, really important. And I think we all feel really strongly that you don't need a Nobel Prize in science to understand research. We feel really strongly that it should be portrayed in a really sort of user-friendly and accessible way, as we've discussed before, and our aim is that we get that across in our book. So if you are in any way feeling that, oh, I don't get research, this really, we feel this really is the book for you, because we feel that we do explain it, and that is our mission really in this book, to make research come alive to students of all disciplines, both at home and internationally.
Well, it sounds like there's loads of information out there, so we should all be doing evidence-based practice fantastically to an amazing high standard. But I think we can probably argue that that doesn't always happen. So what are some of the barriers to evidence-based practice?
Yeah, you're right, Ruth. You know, we've described it looks so easy, but these are barriers that are written about worldwide. So on an individual basis, from a practitioner point of view, it's having the time to do this, you know, the resources, being able to access the research once you've got it, having the skills to assess it, critically appraise it, you know, and it's the confidence in doing this. But within that, you also need a culture that embraces evidence-based practice. You know, a barrier would be if you're in a culture that said, well, we've tried that, it didn't work. You know, we haven't got time to be doing that. This is the Oxford way, that type of thing. But critical within a culture, we know, is around leadership and the role that leaders play with this. And do they have the experience in implementing evidence-based practice? You know, and their confidence. So it's looking at the structure and processes that we have within organisations to support evidence-based practice. So just a few of the barriers, but as I say, it's sort of well written about, because this is difficult.
We often say that, you know, the simple bit is the process for doing it. You know, we can all teach students how to search and appraise, and, you know, those skills students develop fairly easily. And we always say that, you know, that the complex bit really comes when you're applying this in practice. And can I just flag up as well, from an author team, that Lucy has taken her work within this book into developing her own research study, if you don't mind me saying, Lucy, looking at how we embed a culture of evidence-based practice more from a sort of leadership, from a cultural perspective, because she's identified the importance of finding out how we best, that it's difficult to do, and finding out how to do it.
Changing the topic a little, Helen, you're quite a prolific author. What made you first decide to write a book, and this one about evidence-based practice?
Oh, that's a really good question. I think for all of the books I've written them because I've identified that there's been a gap. I've been searching for a book just to recommend to students and maybe haven't found one, and then decided to write the book, to write it myself. And I guess the point there is to emphasize that no author of a book really starts off as an expert. That expertise you gather along the way. So I often say, you know, if you really want to find out about a subject, consider writing a book about it, because your knowledge will just develop and grow. And you get feedback, you get peer review, you get feedback from students. So it can be a really, really good way for your own professional development. But for all of the examples of the books that I've done, there hasn't been a book, and it's been my desire create something that's accessible and student friendly. And I'm really delighted when students say to me that their books have helped demystify a subject which is potentially complex. And I think that's probably the main thing that my books are probably known for, is unpacking a subject and making them user friendly. And I was really keen to do the same with evidence-based practice, because we all know that it's an area that where people struggle. So I think it's about, if there isn't a book and you feel that there is a gap for the book, then there is a book waiting to be written. And I think when you're a practitioner in the field, in my case in education, you're really aware of what students' needs are, and it's trusting your own instinct on that. I think not thinking, oh well, what have I got to offer, but if you perceive that there is a gap and that students could learn something differently, then that does demonstrate the market for a book. I think a lot of texts are too complex and sometimes lose students. And I know I've been at the other end of this, lose students before they've even begun. So we were really keen to start this book at the very beginning, not assuming any knowledge. And then hopefully we then take our students with us rather than assume a lot of knowledge. And I think that's particularly the case with research methods textbooks. They can often be too big, too complex, and students given up before they've even started. So that we were very conscious with this to start a step below and make sure that our primary aim was that the work was accessible. It's still accurate, and we make a lot of effort in checking out that the understandability, but also that we're not losing the concepts in it that we're trying to that we're writing about. But our key aim is accessibility for sure.
Okay, well, you've motivated us all to get writing. Do you have any top tips for new authors?
For me, I think I've just answered two questions in one then. But I think it's knowing your students and knowing the subject and then marrying the two. That would be my tip. I think you've got to know the area and know the subject, and then marry the two up. But Kathleen and Lucy, what would be your tips?
Well, considering the tip you've just given there, knowing the audience and knowing the subject, although accepting that you might find out more about the subject knowledge as you delve in, is having the confidence within yourself to have a go.
Yeah.
You know, for a long time, I thought I would never be able to dip my toes into, writing a book. And it's also, for me, it was the chance of networking with colleagues. And if it's your very first time, perhaps you do, rather than striking out on your own, perhaps you do want to get involved in a collaborative project of writing a book, because it can be quite a supportive process, bouncing ideas off and being able to ask your colleagues, your book colleagues, questions, and getting them to read through your writing as well. So getting feedback, sort of 360-degree feedback is important, and it certainly helped me develop on. I don't know if you've got anything else to add, Lucy.
Yeah, no, and it's just a different style of writing. So it was quite nice to take a break from sort of academic. So you use that, but you've really, as we've said, really think about your audience, your style of writing. But it's a great experience, but yeah, you'll feel sort of underconfident to start with, but then what you produce, you can be really proud of.
Thank you. I think we're going to move to question and answers now.
Wonderful. Well, I have some questions that have come in over the course of the webinar. So I just want to dip back to something that Lucy mentioned. We've got a question that relates here to evidence-based practice. Someone's mentioned culture of evidence-based practice that Lucy spoke on. How do you best embed that culture of evidence-based practice?
Yeah, so in practice, what I think it's about is just having that questioning approach, you know, and I was thinking about handover, team meetings, the project, starting with what's the evidence for this? I went to a conference on equality and equity in the workplace, and it was fantastic to see a slide that said the evidence base, you know, using the library, but then it's using the mechanisms as the structures, as I said, to pick up that evidence and say, well, how are we going to implement it? So one of the examples that I've brought back is really how we de-bias recruitment processes, right? Who do I need to speak to? Who's the network? So it's not being defeated by, you know, by the size at hand. And I think it's that, how you create it. And as leaders, we have a real responsibility for contributing to that.
I think it's important as well to flag up that often evidence isn't there, hence, Lucy, the development of your own project, isn't it, in exploring how we do create an evidence-based culture. So watch this space for Lucy's research, I think, as well, should be flagged up.
If there's another book there, Lucy, just do reach out. Another question, this one from the perspective of a student. As a student, what is the quickest win for me in evaluating and demonstrating evidence-based practice?
Oh, the quickest win. It's about, if it's in your assignment, it's about demonstrating that you're using research in your assignment, I think, without a doubt. So if you can demonstrate that you're relying and you're drawing on research for your assignment, that for me is the quickest win. I'm quite a big fan of students actually telling us a little bit about the sources they use in their work. If words permit, tell us that it's research and that you understand that it's research. That means a lot more than just putting a reference which, you know, doesn't draw attention to the fact that you understand what evidence you are using. And I think it's also really important that, I mean, as a really fundamental test, can you recognise research evidence from non-research evidence? We get all of our first years to do this, and it might sound a very sort of basic exercise, but I think it helps give people confidence that they can recognise research and then use it in their assignments, rather than assuming that everyone can recognise a piece of research from the word go.
So it's about being able to demonstrate that you have those kind of key skills when you submit your coursework. You know, very interesting. There's some top tips coming out there which would be quite useful sharing later. Another question, how do you balance making a resource that is relevant across multiple disciplines in health, so they're useful for both the student of social work and of nursing, for example?
That's a really good question in terms of examples, because you want to be specific enough so that individual students on different disciplines appreciate the relevance to their own practice, but diverse enough to be included. I think what we like to stress is that students can learn from all the different examples. It's probably the main principle. We would say that all of the examples that we do use are relevant to the principle we can, and we do try to draw the principles out so that the students are guided to the principles, not just the practice example. But I think that's a very good question, because we do try to get breadth, but in getting breadth we don't want to lose the depth of that's relevant to a particular profession. Don't know if Kathleen or Lucy you'd add to that at all.
No, I think that was a perfect answer in that respect, Helen, because we did try to use examples that went across all the professions and disciplines, and like you say, that you've got a take-home message from each of the exemplars that are put in there, without thinking, oh, that's related to nursing, it's not relevant to me, because evidence-based practice is a whole generic topic, isn't it, which covers everybody, and everybody can engage in it equally. It's not explicit, or it doesn't exclude you just because the exemplar does not fit your particular profession. So do read the book, as generically as possible, and maybe write down the points that are coming out from each of the examples. And we've got lots of sort of top tips in there of and summaries of what each chapter was trying to tell you, and of things to move forward on.
And then, having the privilege of being part of the planning conversations that go on around the book, I know that the key strengths of these books from Helen and from you guys are that they have that kind of wide relevance across the disciplines. They really are a good kind of example to set for the industry, that we can't go too broad, but we can't alienate any of the disciplines we're trying to make these useful resources for. And I guess that kind of segues into a question for Fiona and Ruth. I know that you use the books in your program. I guess what would you say the key strengths are to the evidence-based practice book is, and other books from Helen Avyard and her co-authors?
I think for me, it's what Helen stressed about trying to keep it basic and understandable for novice researchers, novice readers of research, but also to allow people who have more experience to take it to that next level and to explore things in a bit more depth. I think that ability to impact across a broad range of learners, right from their first module through to their dissertation module, and I'm sure Fiona will come in a minute about the master's programme. It covers across all of those range of programmes, and that's what's really valuable for me.
I would absolutely agree with that. I mean, both of our programmes are post-registration programmes, but they're also multidisciplinary programmes. So we can have physios, we can have OTs, we can have social workers, we can have nurses from an incredibly diverse background undertaking any of our modules up to the point of completing their dissertation and gaining an award. And they are all coming from very different experiences, having done training 20 years ago, having done training more recently, but not having an exposure to research as part of that in the same way that is perhaps more accepted here in the UK, because we have quite a large number of students who've done their registration overseas, and they're coming into a new way of learning, a new approach to assessment often, and they really need that support to gain that, not just the basic understanding, which I think that the book is really good at, but taking them on to that next level, pushing them, and they're still using the resource when they're completing their master's dissertations as when they started their first top-up level 6 module to get their top-up degree as well. And we have students who do that with us, and we continue to recommend the books that Helen and her various co-authors have worked on, because they are really good resources. They support the students, and the students feel that they are manageable to read. Because you're right, Helen, you mentioned before, thick, very high level, excuse me for using that term, but they can be really intimidating reads for students. And actually a nice, easy to start reading and to go through section by section approach is a real strength of the books.
Oh, thank you very much, Fiona. That's really, really good to hear, and that is our aim, really. So that's really good to hear. That's feedback. That's great. Thank you.
I've just got a question that's popped up live from the audience, so I'll go to it now because it's just caught my attention. But what strategies or approaches do you believe are most effective in overcoming barriers, motivating individuals and organisations to embrace an evidence-based practice culture, and successfully implementing and evaluating the effectiveness of evidence-based practices within healthcare units? If you want to say it again, I will.
Oh gosh, that's a big. Shall I answer for the individual? I'm going to do the easy one, which is the individual. I mean, the individual, you've got to break down that barrier that people think they don't get it, haven't you? For me, the best bit of my job is students who think they can't do it, and then with a little bit of encouragement realize they can, and then I just think fantastic. They understand the nature of evidence and how to use it, and that's brilliant. But I'm going to say I think that's the easy bit in many ways, and I think the hard bit is the bit that Lucy was talking about earlier on. Is taking that into the professional culture, Lucy, isn't it?
Yeah, I mean, obviously we're really aware of the limited resources within healthcare currently. So we're looking at productivity, for example. So looking at our patient pathways, how do we reduce waste? So again, looking at the evidence there, so you'll see it in different forms within an organisation, with the patient at the heart, engaging clinicians. You know, as I say, to review what's the best care that we can give to our patients. That's, you know, and that's you'll feel it within an organisation. You'll feel if it's authentic. You know, I have challenging conversations with finance because it feels that it's about the money, you know, and it's being able to articulate it in a way that demonstrates this is going to benefit patients. This is better for our staff. You know, and the research I'm looking at is the study I'm doing is working with the Shelford Group, so 10 organisations, but we know that there's you know, research focused organisations. So yeah, it's a really interesting topic to get in, but complex.
And we always sort of ask our students to be critical, don't we, in practice? And I can think Lucy is speaking to exactly that as well. We always ask students to be and ask for the evidence base, and I think students can do a lot as well to sort of nudge the culture of certainly of an individual ward. If they keep saying, well, why are we doing this? Where's the evidence? Can you explain it? That maybe even, you know, students think, well, how can I contribute? But even by taking that questioning attitude can help develop that culture.
Yeah, one of the things that sort of what I recognise is within teams, they support staff to go on courses, giving them the time out. So we talk about one of the barriers being we haven't got time to do, or you can support then colleagues to go on the critical care in-house course, to get time out, to explore what is the evidence and then bring it back into practice. We work quite closely with our quality improvement team as well, sort of making it accessible to review practice, to have that support, to follow a framework and to make a difference in practice and to evaluate it.
I would just, I'm not an author, I'm not going to pretend I am, but one of the things that I do with my students is I send them back to their clinical areas to do something, and then I'll say, right, you need to come back to me and tell me what you've done about what you found. If it's really good, then you should be congratulating and acknowledging that. But also if there are things that you found, you know, for example, my dementia module, I send them off to do an environment assessment of the clinical area, whatever it is where they're based in. And that could be in people's homes, it could be in outpatient areas, it could be GP services, it could be hospital wards. And then I say, okay, so you've identified all of this. What can you now do about this? Who can you go and talk to? Who do you need to engage to support the things that you know now, having learnt this from our course, would potentially improve the experience of the patients and of the staff and of the overall experience of coming into that environmental area. And I think it's really difficult, but one of the things I always say is chipping away, and you can do a bit and your colleague can do a bit and then someone else can do a bit. And don't be afraid to ask. And I always say ask rather than challenge, because challenge can feel quite difficult for some people. I'm going to go and challenge my boss. I'm going to go and ask my line manager about why we do it like this. And I think that that's, you know, that's putting it in a really manageable way, I think is a nice way for people to go away and think, okay, yeah, I can go and ask my manager why we do that instead of that. And there might be really good reasons why they're not, you know, doing something right now. It might be that then they can become involved in planning for change into the future. But we all know change, whatever it is, wherever it is always a massive challenge.
Very well answered. I think we have time for one more question, and we have a strict 2-minute limit on the answer it. We're out of time. But Helen, I suppose it's one for you, Helen, as you've been obviously on the books over all the editions. But of course, anyone can probably pitch in over the topic. But what are the most significant changes in evidence-based practice you've seen over the course of the editions? and what changes do you think are coming, both academic and in practice? So I guess maybe like a highlight reel.
Yeah, that's a good question. I think probably what illustrates our book the main is that we are really inclusive of evidence. Forget this hierarchy of evidence which only applies to evidence of effectiveness. Forget all of that. We look at how evidence might how different questions need different forms of evidence, and I think we've been really strong on that throughout. So a very sort of inclusive, you know, the evidence about all aspects of health, all evidence is important for all types of questions, not just the sort of traditional questions about evidence of effectiveness. And I think that's probably been a core feature of all of the books, and it's got stronger because a lot of healthcare, the questions are very diverse, and we encourage students to look at a diverse range of evidence behind that. So I think that was probably the key thing that's developed as the book has gone on. So yeah, I think that's probably the key thing.
Interesting to see that as a trend, and probably something which I think applies to research more widely and how people are approaching it. Well, thank you so much for a very robust conversation. Thank you to the audience and the challenging questions in the Q&A, and of course to Fiona and Ruth for asking those questions for Helen, Kathleen and Lucy. It's been a wonderful conversation. I have, shameless plug, put in the link to the book into the chat. There is a 20% discount code, so we're cheaper than Amazon if you go to our website. And that Open Up 20 code also works across Helen's other titles. So please do check them all out. We're here to support academics, practitioners and students in their learning and continuous development. And it's been a wonderful webinar. We will be hosting it on our YouTube channel for those who couldn't join us and share the recording. But until next time, thank you all so much.
Thank you, everybody.
Thank you.
Thank you for the lively discussion.